Medications that are harmful to the kidneys are called nephrotoxic medications. Some of these medications only slightly worsen kidney function, while others could cause more serious injury. Your risk for kidney damage depends on your individual health conditions and the medications you're taking. Highlighted below are the top 7 drugs that have been linked to kidney damage. Before start, please subscribe this channel for more informative videos. 1. NSAIDs, like ibuprofen. Nonsteroidal anti-inflammatory drugs, NSAIDs, are popular remedies for pain and fever, and they're widely used to treat a host of health conditions, such as rheumatoid arthritis, menstrual pain, and inflammation. Some common NSAIDs are ibuprofen, Advil, Motrin, naproxen, Aleve, Naprosyn, meloxicam, Mobic, diclofenac, Cambia. While NSAIDs such as ibuprofen are generally well tolerated, taking them does pose some risks. These medications can reduce blood flow through the kidneys, which can contribute to kidney damage or failure. People with heart failure, liver disease, or existing kidney problems are at a higher risk for experiencing new or worsening kidney problems from NSAIDs. In general, it's best to take NSAIDs sparingly, at their lowest effective dose, and for the shortest period of time possible. Occasional doses of NSAIDs taken in recommended amounts are much less likely to cause kidney damage. 2. Diuretics, like hydrochlorothiazide. Diuretics, or water pills, treat health conditions such as high blood pressure and heart failure. Popular diuretics include hydrochlorothiazide, furosemide, Lasix, spironolactone, aldactone, triamterene, direnium. These diuretics are typically well tolerated, but, as with all medications, they can cause side effects. One potential diuretic side effect is acute kidney injury, especially in older adults. This is likely because diuretics lower blood volume, which disrupts the filtration process. But diuretics, especially in recommended doses, are not always bad for your kidneys. Kidney damage is more likely with higher doses of diuretics. 3. ACE inhibitors, like lisinopril. Angiotensin-converting enzyme, ACE, inhibitors can be good and bad for your kidneys. These medications are easily identifiable because they end in pril, such as lisinopril, Zestrol, benazepril, Lotensin, enalapril, Vasotec, ramipril, Altace. ACE inhibitors are go-to medications for managing high blood pressure and heart failure. And in these conditions, they can protect the kidneys. But ACE inhibitors are cleared out of the body through the kidneys, so they also carry a risk of causing kidney injury. You're more likely to experience kidney problems related to an ACE inhibitor if you're dehydrated or taking other nephrotoxic drugs. In either case, you will likely start on a lower dose. Your HCP may also recommend that you come in for routine blood tests to monitor your kidney health over time. 4. Iodinated radiocontrast. Iodinated radiocontrast refers to the contrast dyes used during radiographic testing, such as a CT scan. The dyes make it easier to detect any abnormalities in your organs and blood vessels during the scan. The downside is that iodinated radiocontrast agents can lead to kidney injury. This type of kidney injury usually appears within 24 to 48 hours of receiving the contrast. And the risk factors include having existing chronic kidney disease, having low blood volume, or taking other nephrotoxic drugs. For people who are at risk of kidney injury from radiocontrast dyes, an HCP will often lower the amount that is used during a test. 5. Vancomycin. Vancomycin is an antibiotic used to treat infections caused by specific bacteria, like methicillin-resistant Staphylococcus aureus, MRSA. It's frequently used in the hospital when someone has a serious infection. Kidney damage from vancomycin usually happens within 17 days of beginning treatment with the medication, and kidney function usually improves after treatment is stopped. Pharmacists and prescribers in the hospital work together to closely monitor you and your vancomycin dose every time it's administered. 6. Aminoglycoside antibiotics, like gentamicin. Aminoglycoside antibiotics, when given as an 4 infusion, are known for causing kidney injury. People with chronic kidney disease, who are dehydrated, or who have been taking these antibiotics for longer than 10 days are at higher risk for kidney injury. Common 4-aminoglycoside antibiotics include gentamicin, tobramycin, streptomycin. These medications are typically only used in hospital settings, which allows for close monitoring during treatment. An HCP may adjust a person's dose to be less harmful to their kidneys depending on their medical history and treatment response. 7. HIV medications like Truvada. Certain HIV medications have been linked to kidney damage. Tenofovir disoproxil fumarate, Viriad, on its own and in combination products like Truvada and Stribild, can cause acute kidney injury in certain situations. The same goes for atazanavir, Reata's. It's important that anyone planning to take these medications should first be screened for kidney problems. People with existing kidney problems may need to take a lower dose to be safe. Not all HIV medications carry this risk to the same extent. For instance, the newer formulation of tenofovir alafenamide, Vemlidy, is less likely to cause kidney damage. This is also true for tenofovir alafenamide combination products, such as Descovy and Biktarvy.